I'm Dr. Ben Newman. I'm a coronavirus scientist, and I'm going to try to answer your questions today. Okay, let's see. And as always, wardrobe by Nicola. Yeah, ancient wardrobe by Nicola. Yeah, with the little octopus and diver and shark today. Okay, next question is from Patty. How you doing? Let's see. All right. So, I have a family member who's reluctant to get the vaccine. Yeah, I think we all do. If you go far enough in the family, anyway. Person is also military and has had many vaccines imposed on him throughout his career. Yeah, that's a thing. The military give you a whole bunch of stuff, don't really tell you what it is, just say, here are the things you're going to get, soldier, and yeah, thank you for your service, but whatever, you're getting them. Yes, and so I have seen that definitely among some people that I know who are ex-military and are just wary of everything. Yeah, yeah, and it's not that there's necessarily a reason. It's just that when you've been pushed around by somebody for a while, it doesn't feel good, and you like to push back. I mean, I feel like that might be part of it. Yeah. So the concern is over the safety in the long haul. Yeah, that's goofy. So there are other vaccines. So, like, let's say you take the chickenpox vaccine. That is actually a live virus that's going to live in a little part of your spinal cord. It does a great job while it's there. It keeps your immunity up forever, and it doesn't ever seem to come back out and hurt people. So it's marvelous, but that is a forever sort of change. You've got other vaccines. Mostly you'll see people getting just the inactivated polio vaccine. But back in the day, they used a live polio vaccine, which was super effective. That's why people used it. But in something like 1 in a million cases, uh, it would mutate while it was in a person because it was alive and could just grow a little bit, but couldn't really grow enough to actually do anything. I think there were 6 important mutations in this thing, and sometimes it would change just enough of them randomly that 1 in a million it would actually give the person long-term sort of shedding virus, yeah, or a bit of disease. And yeah, that was the thing. And so that's a potentially long-term consequence. These vaccines are different. So all of these vaccines are essentially zero footprint vaccines. So there's not anything that is going in that's actually, I don't want to say alive because I don't know that viruses are alive. They're just made of the same sort of stuff as everything that is alive, and they follow a lot of the same rules, but whatever. Yeah. So there's no live virus in any of these vaccines. The only thing that you're going to get is some kind of either instructions or an actual protein from the virus, just a little chopped off piece. And yeah, just like the steering wheel of a car isn't going to hurt you, on its own, but attached to a car moving at you at 50 miles an hour, yeah, that's going to leave a dent. So when you just have this one protein all by itself, the protein is actually benign. It doesn't do anything in a person except show the immune system what to look out for. The analogy is like a wanted poster, like they used to put up in the post office. I have no idea if they still do that. But the idea is that you put up this poster so that everybody can see and get recognition of whoever the bad person is. And so if they ever run into them in the street, they can say, oh, I've seen that before. Yeah. And call it in and report it. And boom, then everybody's safe. Yeah. Um, that's the idea behind a vaccine. You're showing a little piece of the virus to your immune system and saying, hey, this is the one you want to recognize. The alternative is actually getting the virus, and this is the difference. So, like, a wanted poster is a better way to communicate a thug rather than if you got mugged by this person, this America's most wanted person, you would probably remember, but that would be painful, possibly life-threatening, and generally really bad. The wanted poster is there so that you do not have to get mugged by this goofball in order to be able to recognize and act appropriately. And that's the same thing with the vaccine. So the mRNA vaccines have the shortest footprint. So we know from animal experiments that those things are 100% gone within a week, and they leave no change behind except that they have educated. The only change is in the minds, but actually is in the within the configuration of a couple of immune cells. And you're teaching them to only go out and attack one particular thing. It's very specific for the SARS coronavirus spike. There's nothing else inside of a human body that is remotely like a SARS coronavirus spike in any way that your immune system would notice. And yeah, so they work really well. Yeah. But I've been teaching long enough to know what it sounds like when people don't want to do their homework and they start coming up with all kinds of crazy reasons why they don't want to do their homework, or they can't, or these various things have happened. And yeah, you wouldn't believe it, but wow. Right there at the end of the term. And sometimes maybe. Yeah. It sounds a lot like this. I think these are reasons, I don't want to say excuses, but these are the reasons that we're bringing up and showing to the public. And I think deeper down, there's probably something else. There's probably a basic lack of trust. Like, I feel like I got pushed around before, and I don't want to get pushed around again. That's not what this is. The other part of the question is whether it's big pharma and pressure. Consider this, though. If you're going to get a vaccine, do you want it from just some guy to like get it out of his backpack and be like, oh yeah, I made 10 of these last night. They're some really good stuff. Here, roll up that sleeve. Let's put it in there. Would you trust that one? Or do you trust the one that's made by the giant company in the enormous vat with all kinds of quality control, so you know exactly what's in every single dose and it's 100% consistent from dose to dose? We do that with every other medicine. And so in a sense, I think we like to say big pharma, and I would imagine there are jerks in big pharma. You can't let everybody off the hook, but to work well, pharma kind of has to be big, because you don't want, little garage versions, craft brewed vaccines, because there's going to be batch to batch variation. And yeah, variation is not good when we're talking about something you are putting inside of you. You want that to be as consistent and as thoroughly tested as these vaccines are. The other point on there was the FDA hasn't approved it. The FDA has given it emergency use authorization. This is the first step in a long process that will eventually lead to full-on approval. But that process is going to take years, and they're going to want to see lots and lots of people vaccinated. They're going to want to follow up on every possible adverse event, and they're going to want to make 100% sure and then 100% sure again, just that everything is exactly right. And so, yeah, it's approved as far as it can be approved at the moment, and it is meeting or exceeding all of the safety and effectiveness goals that I think anybody would have for it. So they're actually really good. And then it's kind of the only way that you can do this on the scale where it needs to be done. We basically have to get everybody in the world, 8 billion-ish people, vaccinated against this thing. And this virus has already put a big dent in life expectancy. So life expectancy had been creeping up. We've already dropped by about a year in average life expectancy, and just because of COVID in the US. And the sooner we can get over this, the sooner we can hopefully get back up and keep getting older, because I think that's what most of us want. So there you go. That's maybe more explanation than you wanted. But I think ultimately, talk to them, ask them how they're feeling. What are their fears? Where does it come from? Ask them to tell you their stories. Talk to them. Tell them why you care about them and why you would really feel better if they didn't die from COVID, and that it's just such a totally unpredictable virus that you never know. You never know which strain you're going to get. You never know what it's going to do to you. And just don't mess with COVID. Just, tell them you love them. Tell them to stay safe. That's what I'd do. I think that's all you can do, maybe. Thanks very much. And hound them forever. Or maybe don't. That's probably bad advice. Thanks very much. This has been Ask Dr. Ben.